Hello everyone. Today I'm going to be talking about preventing skin breakdown by turning patients every 2 hours. It may sound simple, but it's crucial for patient health and is something we can't overlook. Turning patients every 2 hours help prevent pressure ulcers, also known as bed sores. These are painful sores that form when pressure on the skin limits blood flows to other areas of the body, like the heels, hip, and lower back. Without turning patients regularly, the skin starts to break down, causing tissue damage. This leads to infections, slower healing, and longer recovery time. In severe cases, it can even lead to sepsis, which is life-threatening. Research clearly shows that regular repositioning is one of the most effective ways to prevent pressure ulcers. The National Pressure Injury Advisor Panel updates its guidelines in 2020 to emphasize turning patients regularly, using pressure-relieving devices, and maintaining good skin care. These practices are backed by evidence and are critical in reducing the risk of pressure ulcers. For example, a 2021 study published in the Journal of Clinical Nursing found that patients who were repositioned every 2 hours along with the use of pressure relieving devices experienced a 35% decrease in pressure ulcer formation. This is why it's important we stick to the best practices. So, how do we get the team on board? The first step is to explain why this matters. Preventing pressure ulcers means fewer complications, less pain for our patients, and faster recovery times. This leads to better outcomes and higher patient satisfaction. The team needs to know that this isn't just a task. It's a way to make a real difference in our patients' lives. To motivate the team, I'd also make sure to highlight that this is a team effort. Nurses, assistants, and all other healthcare staffs are involved in making sure patients are turned regularly. When everyone takes ownership of the task, we share responsibility and success becomes a team achievement. By getting everyone on board, we create a culture of accountability and collaboration. Everyone understands that their role directly impacts patient safety and care. For this, my leadership style is transformational. I believe in motivating the team by helping them see the bigger picture. Our shared goal is to reduce pressure ulcers and improve patient outcomes directly, and I would make sure everyone knows their part in this effort. I'd set clear expectations, turn patients every 2 hours, but also make sure that the team knows they're supported. Whether it's extra training on proper technique or help during busy shifts, I'm here to ensure that the team has the resources they need. I also believe by leading an example. If I'm actively involved and showing my commitment to the cause, the team is more likely to stay engaged and follow through. This isn't just about giving instructions, it's about showing the team I'm invested in the process too. Let's take a closer look to the research behind this. As mentioned, the NPIAP's guideline from 2020 emphasized turning patients every 2 hours. Using pressure relieving devices and ensuring good nutrition, these are all essential in preventing pressure ulcers. These guidelines also stress the importance of skincare, keeping skin clean, dry, and moisturized, which can help prevent ulcers from forming in the first place. In addition, a 2021 systematic review found that a combination of regular repositioning, pressure relieving devices, and good nutrition reduced the risk of pressure ulcers by 35%. This shows us that turning patients is effective on its own, but it's even better when combined with other measures like proper nutrition, hydration, and appropriate mattresses. Once we have the team on board, it's time to educate them. The best way is to ensure everyone understands the importance of turning patients regularly. This will be done by providing clear training and holding meetings or in service to demonstrate how to properly reposition patients, and also how to use turning schedules and how to use alarm systems to remind us to stay on track. We also want to make sure that there are visual reminders in each unit, posters or charts that highlight the turning schedule, along with reminders about checking for early signs of skin breakdown will help these practices top of the mind. Simple things like checklists can go a long way in helping staff stay consistent. Another strategy is staying on track. Once we've put the plan into action, it's important to check if it's working. The first thing we need to look at is whether we've reduced the incidence of pressure ulcers. We'll track the number of cases before and after we implemented the 2-hour turning schedule. If we see fewer ulcers, we know it's working and our efforts are paying off. We also need to monitor staff compliance. How well are team members sticking to the turning schedule? Are there any area where the team is struggling to follow through? Unit audits can help identify these areas, and regular feedback will keep everyone on track. Another piece is getting patient feedback. If patients are reporting fewer issues with skin breakdowns, it's a clear sign that our efforts are making a positive impact on their care. We can gather feedback through surveys or direct conversations with patients. Finally, to track long-term progress, we can use quality improvement tools like run charts to see if we're consistently improving over time. This data will help us make adjustments where needed and continue improving our care practices. By combining education, clear leadership, and regular evaluation, we can make turning patients every 2 hours a seamless part of our daily journey. It's a simple step that makes a huge difference in preventing pressure ulcers and improving patient outcomes, which is our top priority. And when we all work together, we can create an environment where the care we provide is always the best it can be.